Hi, my name is Nicole Neal, and I will be talking about autism spectrum disorder today. I figured it would be easier to record it so that I could actually speak through versus having a lot for you guys to read, so I hope that you enjoy. Autism spectrum disorder, otherwise known as ASD, is a neurodevelopmental disability that showcases through differences in behavior, communication, interactions, and learning. The cause of ASD is actually unknown, but several genetic and non-genetic factors have been characterized that, alone or in combination, are implicated in the development of ASD. Continued research focuses on brain development and function, and these studies have identified central nervous system pathologies at gross morphological levels and the cellular level. ASD is classified as being related to synapse dysfunction. Specifically, genes known as the 207 SFARI genes, SFARI genes, play a crucial role in synaptic function in the brain, along with ASD-associated genes involved in synaptic homeostasis and synaptic plasticity. Those have both been found to be affected in patients diagnosed with ASD. Additionally, it has been proposed that early brain overgrowth in ASD is followed by a phase of growth arrest during development. So simply put, as increased head circumference and intracranial volumes in young children arise, that bears an association with a possible ASD diagnosis. Additional studies have found the brain structure of young individuals with ASD to contain alterations in the lateral occipital lobe, the pericentral region, the medial temporal lobe, and the basal ganglia. Further differences include brain connectivity alterations found in patients with ASD, and lastly, GI system involvement has been associated with ASD, showcasing in the form of GI dysfunction. In conclusion, even with all of that, diagnostic biomarkers are unavailable, so the diagnosis of ASD is ultimately based on typical features that present, while there remains a strong basis regarding the need for further research and clinical data relating to pathology. So next, we're going to be moving over to the right, where I have a figure there that we'll go over in just a second, but we are now going to discuss the clinical manifestations of ASD, but before we do that, we should go over the multiple forms of autism. They're each unique and based upon their differences in pathogenic mechanisms and clinical manifestations. Specifically, there are 3 ASDs included in the DSM-5 diagnosis, and this includes classic autistic disorder, Asperger's syndrome, and pervasive developmental disorder, not otherwise specified. Most notably, these 3 disorders are grouped due to their similar presentation of the signs and symptoms, along with their closely related genetic factors, which explains the common occurrence of these disorders in families. So the diagram on your right I added because I think it does a good job of outlining the symptomology and varying clinical manifestations of ASD. So as shown, as you can see there, and as I kind of already mentioned, the differing and varying clinical symptomologies and manifestations that present for people with ASD can cause challenges in his or her life and can also make it difficult for these symptoms to be differentiated from other psychiatric or behavioral diagnoses. People diagnosed may exhibit few of these behaviors or symptoms, while others may experience most or all of them. So it's important to note that a person does not need to have all of the following symptoms to be diagnosed with ASD. These categories of ASD signs and symptoms include the following. We have social communication and/or interactive behaviors, restrictive and/or repetitive behaviors as well. Among social communication and interactive symptoms, varying presentations include little eye contact, infrequency with sharing emotions or enjoyment, being slow or failing to respond to one's name, difficulty maintaining conversational dialogue, and many others. Moving along, among restrictive and repetitive behaviors, possible presentations include repetition of behaviors or phrases, having an intense and lasting interest in a specific topic, becoming upset at slight or inconsequential changes in daily routine, and possibly being more sensitive to varying sources of sensory input. Lastly, people presenting with ASD have also been found to experience sleep difficulties and possible irritability. So like I kind of already touched upon, the screening and diagnostic methods of ASD remain pretty complicated as patient outcomes and improvement of symptoms showcased highest effectiveness if applied early, yet, as I mentioned, ASD diagnoses are very often delayed, misdiagnosed, or even missed among healthcare professionals because there isn't a specific medical test used to diagnose it. It basically goes off of symptomology. However, with that being said, the American Academy of Pediatrics has recommended universal screening for ASD in children between the ages of 18 to 24 months. This screening consists of a developmental questionnaire and checklist based upon research that compares a child's developmental milestones to others of the same age and where they should be. Additional developmental monitoring is an active and ongoing process of watching a child grow and discussing with the child, assessing for oneself, and also speaking with parents regarding skills and abilities, if those skills and abilities meet developmental milestones in playing, learning, speaking, behaving, and moving. There are varying members of the healthcare team and a child support system that can be involved in this, and this includes everyone from their parents, grandparents, to providers and nurses. Following this, more formal developmental screening involving language, movement, and thinking skills, along with behavior and emotion questions via questionnaire can be used. The results of a screening actually does not indicate a diagnosis, though. So if a screening is done, that's not indicative of a diagnosis, just whether the child is on a proper developmental track or not. And then if it's found that they're not, a recommendation to a specialist will be initiated for a closer look, and a formal evaluation will then be done. Considering how someone diagnosed with ASD and their families are affected by this for the duration of that child and family's life, teaching and health promotion are not only important but essential to the overall quality of life of the patient, of the parents, and of the family. Current data has found that the most optimum outcomes have occurred for patients with ASD when members of the healthcare team, including advanced practice nurses and the psychotherapists, actually work in conjunction with schools and teachers, offering further education, current evidence-based practice. So the specific types of treatment that can be initiated for patients with ASD include behavioral approaches to treatment. These approaches focus on changing behaviors by understanding what happens before and after the behavior so that it can be curved. Then further developmental approaches focus on improving specific developmental skills like language skills or even physical skills, and they're often combined with behavioral approaches. The most common developmental therapy for people with ASD is speech and language therapy. Further educational approaches, educational treatments that are given in a classroom setting are necessary. One type of educational approach is called the treatment and education of autistic and related communication handicapped children approach, and that has been found to be very effective. And additional social relational approaches of treatment focus on improving social skills and building emotional bonds. There is the option of pharmacological approaches. However, there aren't medications that treat ASD itself, but there are medications that treat co-occurring symptoms. And lastly, there are varying psychological approaches that can help people with ASD cope with concurrent conditions like anxiety, depression, and other mental health issues.
Next, we will discuss the role of advanced practice nurses, specifically focusing on the importance of providing patient and parent education. This is so important because current studies show improvement in patient care and a decrease in parent role giver strain over a long period of time when this education is provided by the healthcare team.
As a Christian nurse, we not only have an ethical obligation to our licensure, to the Advanced Practice Nursing Board, but also to our Father himself, and to provide care to his most vulnerable of children,
especially those children who will unfortunately experience discrimination due to their diagnosis.
And then over to the right, it's kind of small, but I included a figure because I thought it was just a great way to end the presentation because it's showcasing the members of the team. So as you can see, there's mental health nurses, school nurses, specialist practitioners, social workers, and language and speech therapists.
All of these roles are just as vital and important to every patient with ASD, considering how expansive the diagnosis is and how it kind of affects every aspect of that patient's life. So we've now reached the end of the presentation. I hope that I didn't bore you too much, and I look forward to reading through the rest of yours. Thank you.